Hello, Graham Warren, working with you on innovations to the hip-hop case workflow. In the previous clip, we explored the lens of utilization matters, adding a CRNA or an AA, an anesthesiology assistant to the two pools, anesthesia pros A and anesthesia pros B. And we noticed that there was an impact on the number of surgeries that were completed each day in both tracks, as well as in the patient flow times. I've returned our parameterization to the base case, and I want to explore a new lens, that of psychology matters. Now, in these early clips related to process innovation, what I'm doing is I'm going to entertain one change at a time. What this allows you to do is to sort of identify the delta that comes from each of these proposals in isolation relative to the base case. Once you start making composite scenarios, you sort of lose the ability to sort of tease apart or tease out that delta of each of the proposals. And the reason why, there's different ways of doing this, but the way I'm doing it allows you to determine in isolation what each of these changes bring, so that if there was some sort of prioritization for budgetary reasons or some other reason, that you would be able to say, okay, we can afford changes that one or two changes, and these other changes they would be. We still want to test all of these proposals in combination in a composite scenario, because there's various synergies that are going to be produced from these different innovations. And exactly what they would each bring sort of as a delta, as a marginal contribution could be hard to estimate with the sort of rough cut analysis that we're doing in this case. Okay, so let's dive into the psychology matters piece. Now, what I'm looking at here is the idea that the KPI that is most directly connected to psychology, in my opinion, is this flow time. And what I'm interested in, in the base case, I had flow times that were in the ballpark of about 190 to 200 minutes. So what I noticed was when we were doing that early simulation, that the flow times got longer and longer in the day. And it's sense reason that's reasonable. That's reasonable, because what's happening is, if you're the fourth or the fifth patient, you could have a logjam ahead of you where, patient 2 or 3 could have had high BMIs, and their surgeries could have run on longer. And so you're sitting in the hospital waiting for the surgery, your flow time blows up as a consequence. So I wonder, if I were to release patients into the hospital or have them arrive at a slower pace, not one every 90 minutes, but maybe one every 115 minutes, let's say. It's only winning 15 minutes. Or 25 minutes, but I'll take it, right? So that's my question. Can I release patients into the hospital at a slower rate in order to win some reductions in the flow times? So in the base case, we observed that flow times are about 190 to 200 minutes. The way I'm going to get this to go is I'm going to adjust the inter-arrival time. Instead of having it 90 minutes, I'm going to go with 115. So savings of supposedly 25 minutes in each track. And I'm just going to run this and just see how it goes. Okay, and I'll run it to completion. So we didn't get any help on the number of surgeries. Got 4 and 4. The numbers here are 177 and 170. So it seems like I may have, I think about 190 to 200, they both seem to be in the 170s now as opposed to the 190. So I've got about, that 25-minute delay seems to translate it into a win here of about maybe 20 minutes. So let's see if this holds up if I do it again. And I run this one to completion. So here I got it a lot lower, 155 and 181. Still got 4 surgeries in each. I'll do a third rep and run it to completion. 4 surgeries in each, 177, 191. So now, not so clear this one's any better, but you may have to run more replications here to sort of get an average. So 159, 172. It seems like this could bring some value. And you may have to experiment with, how much slower these interarrival times are going to be. So maybe not 115, maybe it's 125, and you can play around with that. But the idea here is that, this is an anxious time for folks that are getting a major surgery. You can help them out by, not having them in the facility, other than health considerations related to infection and other things like that. Just having a shorter time helps them out with the anxiety, also helps out the friends and family who are maybe just as anxious.